A 71-year-old with no known past medical history. She actually lives on a farm and presented after waking up with left hemiparesis. She presented to an outside hospital with an NH scale of 22. She was outside of the window for IV TPA. She was transferred to our institution for thrombectomy. And this is what her curves looked like. In fact, I showed you, I think, this one yesterday. And this is what her AIF and VOF curves look like. So right away, we should think, wow, I'm not sure that I can really believe the data because there's just so much motion. So right away, we should think, I bet I'm going to generate a report that's non-diagnostic here. But let's just see what happens. Because, again, it's nice that RAPID identified this as significant motion. But I can see that on the data set, the CTA data set that's derived as part of the CTP, that I actually have a pretty nice delineation of the left MCA circulation. I can see that the AIF was placed nicely, the VIF was placed nicely, and I can certainly see that there's asymmetry in the entire right hemisphere relative to the left.